This is Breast Cancer Part 2 and will address medical and nursing management. Medical management includes a surgical approach as well as chemo and/or radiation therapy. The approach depends on the pathology found at biopsy, the size, and the possibility of metastasis. Surgery can be minimal, as in a lumpectomy, or very aggressive, as in a radical mastectomy. Of course, one would hope a simple lumpectomy would be all that is indicated, but this is not always the case. A modified mastectomy removes the breast tissue, vessels, and lymph nodes. A radical approach includes taking the underlying muscle as well. Although these pictures aren't pretty, the nurse should know what the patient will look like after surgery, immediately, and if ever admitted for something else. You don't want to have a surprised look on your face when you do your assessment. The picture on the right demonstrates removal of the breast and the axillary lymph nodes. The modified and radical mastectomy approaches leave behind disfigurement that can be corrected with breast expanders at the time of mastectomy, followed by a breast reconstruction after healing and radiation is complete. The diagram depicts the difference between an expander and an implant. The expander acts as a placeholder and can be inflated with saline at periodic intervals until the tissue is adequate to tolerate placement of an implant. Nursing management of the patient with breast cancer includes everything discussed in the overview lecture. But focus is needed in the area of pain management, drains, assessing the amount and character of the fluid, emptying as needed, and removing when no longer functioning. The nurse must assess the patient for development of lymphedema. The picture on the bottom right shows a patient with lymphedema. Elevate the extremity on the surgical side, and you will need to elevate both extremities if the patient had a double mastectomy. No one is to start an IV, draw blood, or take a blood pressure on the surgical side either. Make sure to post signs so all patient care providers are aware of this. If the patient had placement of a venous access device, the nurse must monitor its healing also. It is not to be used until the surgeon decides it is okay. Due to the pain, your patient will be very reluctant to move the affected side. The nurse must begin range of motion exercises to get the fingers, wrists, and forearms moving, then eventually raising the entire arm. The patient will fight this and be unhappy, but this is necessary to preserve function of the limb in the long run. Once the surgical sites are fully healed, the patient can begin chemo and radiation therapy. Nursing management includes teaching the patient about compression garments that can be used to control lymphedema. And here are some examples. Teach the patient that she is to remind care providers not to take the blood pressure or draw blood on the affected side. If the patient goes home with JP drains, the nurse needs to teach her and her caregivers how to monitor and manage the drains, what to look for that would indicate infection, such as odor, change in color from bloody and fairly clear to cloudy with strands, or if she develops a fever. The plan of care for a breast cancer patient going through treatment focuses on body image disturbance due to mastectomy, lymphedema, hair loss, and skin burns. The patient may not be up to eating or suffer from nausea or vomiting due to chemo and radiation therapy. The patient is considered immunosuppressed when undergoing chemo and radiation therapy, so must stay away from people who are ill, avoid crowds, and report fevers, chills, or excessive fatigue. Anything she doesn't feel is normal needs to be reported. This patient will have an alteration in her self-care activities due to pain and loss of ability to fully use her upper extremities, and this may include not being able to brush her teeth, comb her hair, or put on makeup. When a patient is undergoing chemo and radiation therapy, it is important for the nurse to be the patient advocate. Keep her own treatment plan desires in mind. We tend to push people into treatment when they may be reluctant. Listen to her concerns. Facilitate the appointments with the various specialists. Provide an explanation of the labs that need to be monitored due to the treatment. Monitor your patient for side effects of the therapy, including the medications. Radiation will begin after chemo and once all the wounds have healed. The recommendations for radiation are 5 days a week for 3 to 7 weeks if the patient had a lumpectomy. This patient probably does not need chemo. Post-mastectomy, especially if the cancer lesion was greater than 5 centimeters in size and metastatic diseases is present, this patient will be in therapy 5 days a week for at least 2 months. The side effects of radiation include skin changes, as in burns, tightness, and pain, fatigue, and a feeling of heaviness in the area being radiated. The best thing a nurse can do is help with the mission to prevent breast cancer from occurring and promote measures for early detection. Teach your patients about lifestyle modifications that are needed to reduce the risk of developing cancer. Teach the patient to do self-breast exam. I posted a web link on Blackboard, and the next slide has additional information for you to learn how to do the exam. Encourage women to get mammograms according to the guidelines. We start at age 50 for all women, earlier for those who have additional risk factors. So here is the self-breast exam. It should be done every month on the last day of menses, so tell the patient to do it the last day that she uses a pad or a tampon. For postmenopausal women, she should select a day of the month and repeat it every 30 days, and call the provider if she finds anything of concern. This ends the lecture on breast cancer.